Hello and welcome. I'm your host, Neil Howard. Thank you so much for returning to Health Professional Radio. We'll be speaking with Mark Carbone, CEO of PN Medical, a company that's helping people worldwide improve their respiratory health and performance. He's going to talk about respiratory muscle training, or RMT, and the breather, the first drug-free device for those who suffer from shortness of breath, speech and swallow difficulties, and other complications resulting from respiratory muscle weakness. Welcome to Health Professional Radio, Mark Carbone. Thank you so much for joining us.
And thank you for having me.
Well, aside from being CEO there at PN Medical, tell us a bit about yourself and what led you to become CEO of PN Medical.
Well, let me be as candid as I can. So as a kid, I was a complainer, and that actually got me nowhere. So I became a problem solver. And, fast forward, I'm 54 now. So today I'm a researcher, an inventor, and a business owner. And I'm also a blessed husband and father to 3 boys, and all 3 are athletes. So that's pretty interesting.
Right.
But going to the business side, 9 years ago, I lapsed back into that complain mode about healthcare costs, or 10 years ago. And, I was on the sidelines, like, what are we going to do? And I had been running another business and doing other things. And I said, hey, let's jump into, I want to jump, head first into healthcare. And there's so much I learned, and I really wanted to focus on my own longevity. I was just past 40, and I wanted to really dive deep and understand the human body more, and how can I live a really good rest of the next half of my life. Mm-hmm. So I fell into it, and I became CEO of PN Medical.
PN Medical is involved in respiratory issues. Give us an overview of how PN Medical is utilizing RMT, or respiratory muscle training, through the breather device.
Sure. Well, at our highest level, we're in the business of human performance.
Okay.
By making the cardiopulmonary system stronger and without pharma and at a low cost. So we actually created this category now almost 44 years ago. We created the respiratory muscle training category using tools like ours. And now we're 2 million patients into it later, and we're still the leader in this space. So it's been pretty exciting.
Now, obviously, your respiratory health is extremely important. Explain to us how this breather device benefits muscles other than the respiratory muscles. How does it deal with fatigue, sleep issues, all of these other things that go along with your respiratory health, or the lack thereof?
Sure. Well, let me step back just a minute. Is that, a great question. And what it is that clinically, at the base is respiratory muscle weakness, and it's typically underdiagnosed for a number of reasons, and that's the big part of what we do, and we do it using a 4-pronged approach. First, we've hired the best clinicians and scientists in the world in our space. We have this RMT device, the breather family, and the medical one is, the one used in health and wellness is the breather, and it's an RMT device that actually, it has dials on opposing sides. As you inhale, you breathe under pressure, and as you exhale, you breathe under pressure. And your lungs aren't exactly equal. They're not even at the same size, as we all know. And you change dial pressures based on where you are, and that strengthens the muscles of respiration, which there are 90 plus of those, and also it affects the muscles of your torso of posture, which is over 100, which is really important, especially as you get older into the elderly population. Posture means everything. It means everything at the athletic level too. And then also we have ever-changing protocols. So these training protocols have evolved over the years just based off what we've learned from patients. And now we've got companion software and pretty soon new technologies coming that I'll probably share towards the end. So it's a 4-pronged approach. You hire the best people to help the people we serve. We've got this RMT device that was first in the world that we've continually modified and refined. And then you have protocols based on each population, because everybody's different. Age, if you have COPD, asthma, chronic heart failure, all kinds of sleep disorder, anxiety, high blood pressure. And then again, to manage it all and monitor it for yourself, there's complementary software app that goes with it.
How does PN Medical differentiate itself from some similar devices that are currently on the market?
Sure. Well, jumping back, it starts with our people. We have to have the best people. And then I feel like we've got pretty amazing novel research. We research population groups all the way from NATO fighter pilots to special force operators, Army Rangers, Navy SEALs, all the way to the highly compromised, like I said, with COPD, asthma, chronic heart failure, spinal cord injury. We go the full gamut. And we do this research all around the world. Lately, we've been doing a lot of research with Mayo Clinic. So the research constantly pushes us forward, and it's even pushed a few patents forward lately because we did a lot of COVID research over the last few years, of course, and especially long COVID. And what this does, it leads to new solutions. So we're constantly inventing new ways to help increase human performance, either getting better or in recovery, or you're just trying to be your best.
You mentioned COVID. During COVID, we discovered that someone who was having respiratory problems, their body was adjusting to the problem and making the person, be able to function and feel as though they weren't having these respiratory illnesses or respiratory issues from COVID. Does the breather help in diagnosing or letting a person know that maybe their lung strength isn't up to par?
Yeah, that's a good question. As soon as you put it in your mouth, you're going to feel the pressure as you breathe in and out, and you're going to notice a diminished lung capacity. So you instantly find this out. And one of the patents we're going for is about that we need to have a breathing reset since COVID. Everybody has to, because 80+% of all humans have some form of dysfunctional breathing pattern, and adults do. And COVID just exacerbated that. And there has to be this great reset where you have to reset the autonomic nervous system. And it's easy to do. It's a simple process.
You mentioned that you had 3 boys that were all athletes. Is the breather indicated for anyone wanting to improve their respiratory health or having problems, or is it just for adults?
Well, we've seen over the years that it works from 8 years old to 98 years old. Okay. So it is across the spectrum. They just go under lower pressures.
And Mark, it's my understanding that you also have a weight loss program.
Sure. This is pretty amazing. We partner with a unit up near Rochester in Minnesota, and we're using RMT, which has a higher standard of adherence, and we're doing this in the obese population, and it's all non-drug. They're eating through portions, and then they're doing our RMT training. And the results will be out soon, and it's amazing. It's astounding that we're making this impact, because it is the only form of exercise they may be getting, and it's forcing a better intake and outtake of oxygen, which is causing more resilience, causing them to be able to get up and move more, and movement is key. So such a basic tool and a system that's not complex, that is actually creating positive results for people.
What's next on the horizon, briefly, for PN Medical, and then give us a website where our listeners can learn more?
Sure. We are going to launch our connected device. We invented it about 7 years ago, and we've refined it, more sensors. So as soon as you put it in your mouth, I can predict an exacerbation 14 days before the patient knows it. But this is going to work at the athletic level all the way to the highly compromised. So this connected device is going to gather so much data that then, clinicians can use, and actually the end user can use to improve their health through respiratory training. And
a website where we can learn more.
Oh, and the website? Yeah, sure. It's pnmedical.com, or you just search for The Breather.
Mark, thank you so much for joining us this morning.
Thank you so much.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Mark Carbone. Audio copies of this program are available at healthprofessionalradio.com.au, also at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.